morning. What a great group. We are thrilled to be able to host you this morning for this very exciting announcement. I'm Dr. Lisa Harris. I'm the Chief Executive Officer for Eskenazi Health. We're happy to be able to invite you into our newest health center for a very big announcement. We're really thrilled about what these two women are going to be talking about in just a minute. We are honored to have as our guest this morning at our health center Dr. Kris, State Health Commissioner, and Dr. Jen Walthall, Secretary of Indiana Family Social and Services Administration, for something that we see as really something that's going to elevate our game here in our state with our commitment to health. And so, before I spill the beans, because I don't want to do that, and I sure don't want to, I am pleased to introduce Dr. Kris Box, our State Health Commissioner, who will start to detail.
Thank you so much, Lisa. It is just amazing to be here at Eskenazi Health in this facility. I had not seen it, and I'm so impressed for what you're doing in this area where this population is so needy of this. This is an incredibly exciting day for Dr. Walthall and myself as we join forces to help more Hoosiers get on that path to improving their health with tobacco cessation. By removing barriers to access and the cost of tobacco cessation products and counseling, we can impact the single most preventable cause of death and disease in our state, and that's smoking. We all know that prevention is the best medicine, but unfortunately 22% of Indiana adults are smokers, including over 13% of our pregnant women. We also know that quitting tobacco use is one of the best things that Hoosiers can do anytime throughout their life. That's why today I'm signing a standing statewide order that allows Indiana residents to obtain tobacco cessation products from their pharmacy without first getting a prescription from their primary care physician. Smoking is a domino that can trigger a multitude of poor health outcomes, from heart disease and lung cancer to stroke and preterm birth. Indiana's high rates of infant and maternal mortality are heavily impacted by our smoking during pregnancy across the state, which increases the risk for stillbirth by over 50% and neonatal death by more than 20%. Women who smoke during pregnancy are at least twice as likely to deliver a preterm baby and to have that baby go to the newborn ICU. And that is the #1 cause of infant mortality in our state. Quitting smoking is extremely difficult. It takes some people years to get to the point that they're ready to quit. We want to remove as many barriers as possible so that when that right time comes, there's no barriers to their getting help. This standing order allows pharmacists to screen, advise, educate, and to dispense tobacco cessation products to Hoosiers over the age of 18 who are motivated to quit and who are not determined to be at high risk based on their health screening. When this order takes effect on August the 1st, Indiana will become the 12th state that has either a standing policy or an order in place that allows pharmacists to initiate a treatment plan and then dispense tobacco cessation products. It is never too late to stop smoking to improve your health outcomes. A woman who stops smoking during her pregnancy decreases the risk by 22% of their baby ending up in the newborn intensive care unit. Your risk of cancer, heart attack, stroke, and lung disease all go down immediately upon stopping tobacco. Those are the kinds of stories that we want to replicate for Hoosiers all across this state, and I hope that this standing order will help us to write them. Now, we know that pregnant women will be considered at high risk and that they will need to consult with their obstetrical provider as to whether a tobacco cessation product is appropriate for them. Dr. Walthall is now going to talk about additional supports that we're putting in place to help these women quit smoking. Jen?
Good morning.
Good morning.
Deciding to quit smoking is incredibly hard. It is also one of the most incredibly powerful possible moments for change. If you approach people about changing health behaviors without judgment, but instead with true interest in their health and the ability to accept whatever stage of readiness they might be in, you will find people who are ready in that critical moment to make a move. we are here to help Hoosiers seize that critical moment. I say moment for a reason, because it can be fleeting, and it is easily thwarted by barriers to success. Tobacco is such a powerful substance that any bump in the road can be a permanent detour to that success. Our job today is to eliminate barriers so that moments actually lead to change. And this becomes the rule, not the exception. This is a huge step in our charge to be the best in the Midwest in infant mortality by 2024, and will help improve the health of mothers and Indiana's tragic maternal mortality rate as well. One of the best things that we can do to improve infant mortality is to make it easier to quit smoking and then stay quit. The first thing we will do within Indiana Medicaid is to extend the elimination of a copay for nicotine replacement and smoking cessation aiding medication for a full year in postpartum women. There are plenty of financial stressors in this time frame, and even a small gesture of support can make a huge difference in success. Additionally, Indiana Medicaid will allow for reimbursement of tobacco cessation specialists in medical settings that provide premium care. This means that when pregnant women are ready to quit smoking, they will have additional supports to aid them during a time of enhanced access to the healthcare community. FSSA is committed to continuous improvement of our services to Hoosiers, and our process enhancement in pregnancy will inform our ongoing efforts to improve and support the health of every Hoosier utilizing our services.
We are also going to continue to support a pilot program that is in 3 of our Indiana hospitals to fund tobacco treatment specialists who can work with patients who want to quit tobacco and connect them with resources like 1-800-QUIT-NOW that can help them to quit and remain quit. These 3 programs are being done in partnership with the Indiana Hospital Association at Columbus Regional Health, Greene County General, and Marion General, and focus on pregnant patients, heart patients, and surgical patients. We'll be working with our medical and our pharmacy partners in the coming weeks to finalize the protocols for this standing order, and I really look forward to working with that partnership. By connecting more Hoosiers to ways to quit tobacco, we can make a huge difference in the health of Hoosiers and ensure that every Indiana resident has a chance to live a long and healthy life. So please join me as we sign this order. And I'm so excited as an obstetrician gynecologist, as a physician, as someone who's lost her mother and family members from smoking-related illness. I'm very excited to be able to do this.
Put the phones down, please.